So good morning, professors. Good morning, colleagues. Good morning, invited guests. And welcome to this presentation. Prof, I asked earlier if we're going to record this.
Okay, so we're going to discuss with the media team to ensure that it's recorded.
Okay. So this presentation is on a scientific study that we carried in the Department of Health Information Management Systems. And the topic of this study was the role of health informatics as a tool for public health transformation. So to proceed, I will quickly take you through the content of what we'll be looking at today. This is kind of an extract from the research paper, and we'll look how the study was conducted, the results we found, possible conclusions, and our recommendations. So let's move first to the introduction. As a prelude to what we're going to be seeing, we are first of all looking at medical informatics and how it transforms public health. So what's medical informatics? According to Becher, et al. And Hoyts, 2023 and 2029, respectively, medical informatics refers to the collection, storage, protection, and kind of processing of information with several goals, some of them to improve healthcare deliveries, to advance research, to help states, institutions, and organizations in policy making. And if you look at these deliveries, you can see where they fit in public health. But what is public health? Public health is a very broad field, and it focuses on promoting and protecting health populations through preventive measures, health policies, community-based interventions, and there are a few areas that we want to look at when we talk of public health. You have the epidemiology, which is more of the study of the distribution and determinants of disease within a population. Health promotion and education. As we know, programs and strategies that educate and empower individuals or communities to improve their health is also marked as a very important determinant in the public health management framework. Disease prevention. These are all areas under public health, environmental health, health policies and management, and this transcends to global health. So in effect, we are trying to look at how the collection, storage, management, and processing health information can lead to better public health.
Sorry, Doctor. Please share us for the screen for the slides.
You can see my screen?
Yeah, no, I can't see.
Is that same with everybody? Can you see my screen, please?
No.
Yes, Mohammed, you cannot see.
Yeah.
What about others? Please, do you see my screen?
Yes, I can see your screen.
Mohammed, you want to kind of log out and log in again?
Okay, bro. Thank you.
I'll give you a minute to join if you. Can you see now, Mohammed?
Yes, I see. Thank you.
You're welcome. Okay, so we're still looking at the introduction. So I kind of picked this up from one of our papers, and I'm trying to give you an impression on the complexity that comes with medical informatics and its relation to public health, and maybe some other factors that affects public health directly or indirectly. So if you look at the center of this, it's all about data. But where does all of this data emanate from? One single person. Of course, a single person cannot make a community. So you have a number of people making a community. So this a patient's community. We pull data from it. Just about that. I need to turn this off. So, with the emergence of medical informatics, there are different technologies that are helping us to collect this data. And when we collect this data, we can use it in different formats. So we have real-time surveillance, we have government policies have been made using this data, well-informed data. We have epidemiological decisions. I hope we understand most of the decisions taken within the health community are epidemiological. When a medical doctor says you have malaria, he's trying to interpret, lay down the cutoff points laid down by epidemiological studies. So we need all this data to be able to make these decisions. And we also have what we call CDS, which is clinical decision support. So doctors need a lot of information to be able to conclude on your health status. And informatics help support that. We also have what we call telenet and mobile health. And sometimes we want to ask ourselves, what is mobile health? What is telemedicine or telehealth? So with mobile health, you have health management through mobile devices like apps. I think we've seen people hold apps to measure their body pressure, blood pressure, and stuff like that. But when we talk of telehealth or telemedicine, we're referring to health services via telecommunication, maybe remote monitoring devices, teletherapy, virtual consultation, remote monitoring, and stuff like that. So we're going to go further to use all these understandings and be able to establish whether or not medical informatics can actually transform public health. I'm not sure why the screen is dark. I'm going to quickly move that on. So, what were the objectives of this study? The intent was just to evaluate the role of medical informatics in the management of some public health practices, because this is not all about public health. But we were focusing on disease surveillance, patient's outcome, that is, when you have an event as a patient, what will be the outcome depending on the approach, either the institution or the organization or the health organization or the physician or the nurses are going to impact on you depending on what technology they are using in that institution. Healthcare efficiency. This includes monitoring, alerting, record keeping, sharing of information, and so on. What method did we use for this study? Given the complex nature of the study in question, we adopted qualitative research design. This was taken under the understanding that this will help us establish data trends, specifically document analysis and data collection methods used in these studies and other studies. So data analysis, we used thematic analysis, also subjective data. We simply say that we are using secondary data. We didn't actually conduct an empirical study. What were our sources of data? So we collected data from national health surveys, published papers, informatic reports, and other reliable sources that we're going to show you very soon. So let's try to acquaint ourselves with some of the basic terminologies we're going to encounter in the paper on this presentation. There are quite a number of things, especially given that we are combining two big giants for public health and information. So we're going to be a bit selective, just randomly pick a few terms and try to explain them. But once you pick the article in full, you're going to get close to more other terminologies. So let's look at electronic health records. So these are just simply digital version of patients' paper chart, written data collection, and stuff like that. Clinical the decision support system. So there are more of computer-based systems that help healthcare professionals make clinical decisions by using evidence-based knowledge and specifically patient information. We also have health information exchange. This is very, very relevant because we know about comorbidity. Patients have to be moved from one organization to another or one health institution to another. And for the incoming patient to be actually received, a prior knowledge of the patient is needed. So this information needs to be shared. So you have to exchange information across institutions, across physicians, and stuff like that. And there are softwares that enable to do this. Telemedicine and telehealth, as we mentioned earlier. So this simply involves remote diagnosis, treatments. Sometimes I'm not sure what happens in all countries, but in some countries, there are some physicians who are licensed for telemedicine. So they have been authorized by the state or the country to be able to consult you online, give you prescription, and so on. All this fall under telemedicine and telehealth. Data management and security. Data management and security become the foundation of knowledge in public health. So you need to collect data from a patient to be able to make diagnostics decision about that patient. It now becomes imperative that the way you collect that data, the way you store and manage it, will play a very primordial role on the final decision you're going to take about that patient. For those of us in the medical field, we've heard a lot about false negative, false positive. These are all shortcomings of data collection and management. Many patients have been given false mammography results because of either poor data collection or interpretation. So we see how some of this falls in place to help public health, which is a combination of individuals' health. In order for us to advance in a scientific fashion with this study, we try to, first of all, set a priori some research questions and some of the questions we came up with. What does medical informatics, or how does medical informatics impact disease surveillance and outbreak management in public health systems? What are the effects of medical informatics on patient outcome and healthcare delivery efficiencies? What challenges and barriers exist in the implementation of medical informatics in public health system or setups? So going forward, we will be trying collecting data, analyzing data with the hope to be able to come out with possible answers to these questions. In a scientific fashion, we try to set up a null hypothesis and an alternative hypothesis. So we nullify that medical informatics does not significantly impact disease surveillance, patient outcomes, or health delivery efficiency in public health system. Means that if at the end we do not have enough evidence to support this, we can scientifically conclude that medical informatics significantly impact disease surveillance, patient outcomes, and healthcare delivery efficiency in public health system. In order for us to do this, we quickly took a literature review. So we looked at historical development of medical informatics and early applications in healthcare. We look at the evolution of electronic healthcare records to advanced analytics, big data and its own analytics, artificial intelligence, and machine learning. So we look across how a lot of organizations have come up to promote research and other aspects that will advance health informatics, medical informatics. From 1960 up to 2016, based on the papers that we have collected, we see how we evolve from basic paper information collection system to advanced electronic systems, coming along with telenet and mobile health, as we saw earlier. So, given the backdrop of the research questions we've set, the research method we choose, we think that will help us answer those questions. Given the data that we are looking at, we go for descriptive research approach. This is used to investigate the impact of medical informatics on the public health. We consider this approach because it has the ability to systematically describe and explain collected data, which gives us a detailed account on how medical informatics affect disease surveillance, patients' outcome, and healthcare deliveries, system productivity. Now, we will use thematic analysis. There's one software called Nivo. So we're going to use Nivo to do our thematic analysis. Data sources. We try to highlight some of the main sources of our data. Given that we are using quality descriptive data, which is subjective by nature, we must be very, very careful in the source of our data. So we collected data from public health records, National Health Survey, published articles, and other reports, like just organizational report and stuff like that. Data analysis. We used a software called Nivivos, which is a licensed software, mostly intended for states and organizations and some professionals that will help them to analyze and visualize data. It's very good for qualitative data analysis. It has the ability to analyze information, for instance, publication, the text documents, PDF, audios, videos. So you can actually collect this into the system and code it properly, and you'll be able to come out with varying reports depending on the background, coding structure, and interest. Ethical considerations. Given that we are dealing with qualitative, descriptive research, we have to take into consideration ethical issues. All the source of data were acknowledged. So we acknowledge every source from which we got our data. All the data was anonymized. So we try not to weight the data. However, this was a decision within this study, but within NIVO, in other studies, you can choose to weight your data. You may want to say that data coming from national survey carries a higher weight, data carrying from individuals or publication carries a lower weight, and stuff like that. But in our case, we anonymize this data so that we should be able to draw a conclusion across. Personal identifiable data elements were not used. This is in compliance with general data protection regulations. So if we have studies that carries PPI, we won't use that data with the backdrop in mind that it was first of all wrong to publish information with PPI. So ethics was a fundamental consideration in this study. Limitations. This study did not provide empirical evidence. So I said this earlier. When we talk of empirical evidence, we mean collecting first-hand data and analyzing it. For instance, we may have done maybe some randomized study and so let's pick institution A, B, C, D, E, and then we give them some telenet or some informatics or some technologies, and we keep some of the other institutions without technologies, and then we try to weigh the patient outcome. We go to some countries, we give them some technology, and then in others we don't give. Then we try to observe disease surveillance and stuff like that. If we had done that, that would become empirical study. But in this case, we didn't do that. We collected records or studies and other stuff and tried to analyze that. So again, this study actually relies on secondary data, and the accuracy of the findings depends on the unbiased nature of the sources of our data. So consequently, due diligence was employed in ensuring the sources used were reputable. That way, it was possible to address the emerging drawbacks in the study. So, given all of that, what were the results we obtained? First, we run a global literature search based on some key things. So we came out with acceptable records based on the criteria we set. No PPI, it should be repeatable and stuff like that. So we have 5 public records, 5 World Organization stuff. We have 5 national health surveys. We have 50 published research articles, and we have 20 reports. After analyzing all of that, using Niveau as explained, these are some of the findings we came up with. We observed that real-time data collection was highly impacted. So we have a bar chart of each of the focus areas and what the collected data came up with. So based on our thematic analysis, we were looking at the impact of medical informatics on disease surveillance and outbreak management. And most of the studies or reports or surveillance data that we collected indicate that real-time data collection was actually being impacted most. We also have the enhanced data integration, predictive analytics. So these are the areas whereby medical informatics highly impact disease surveillance, real-time data collection, enhanced integration, and predictive analysis. There are other areas like enhanced collaboration. So with medical informatics, we can collaborate between organizations, between countries, public health decision as well. Given that we have more accurate information, more broad information, public decisions are highly supported. The next question was medical informatics, the impact of medical informatics on patient outcomes and healthcare delivery efficiency. Based on the data we collected, we saw that there is high improvement in clinical decision making. There is also enhanced patient safety, patient engagement and empowerment. So patients have to take some responsibility on their health. For instance, when we're dealing with mobile health, if an app is given to you and say, hey, this is intended to measure your blood pressure, you as the patient will have to follow some basic rules in order that data to be collected accurately. So there is patient engagement and empowerment. So by you, the patient, paying that attention to that, it's also empowering you. You understand what is happening with your system. Operation efficiency. This was highly impacted. So in the old days, where you keep a patient in a ward, then you ask a nurse, please monitor this patient. So the nurse has to sit there, maybe go make a quick walk around, then come back and sit there to monitor. The system has changed. You set up a technology, and anything happens to a patient, the whole system is recording. And if it goes out of threshold, there is an alarm. So there is an all-round monitoring efficiency. Quality of care was also impacted, and data-driven insight. Data-driven insight means that you are not taking decision based on your knowledge, but you're taking decision based on a global or some technologically supported references. The third question was, what challenges and barriers exist in the implementation of medical informatics and public health system? And the data established that data privacy and security is one of the biggest challenge and barriers that we have. It also indicates interoperability issues. What does this mean? So, when you have a patient that has to be moved from one medical institution to another, these two different institutions are independent or some autonomous. So they have their softwares for doing whatever activity they are doing. If you send maybe medical reports or imaging from one institution to another, what is the probability that the second institution, their equipment will be able to interpret those results just the way the primary institution got them? So these are issues of interoperability. Different institutions have different software, because most of these software are licensed, and the institutions will have to buy software that they need, not software that is used by another institution. But when a patient leave that institution comes to you, they are coming with their medical records that are being constructed under a particular software. Will your software be able to interpret that result? This was a serious issue. Financial constraints. Most of this advanced technology is quite expensive, and most private institutions will need to invest huge chunks of money to be able to acquire this technology, and also the manpower. That's the technical know-how behind this. This is also a challenge. Resistance to change. This was also very important because sometimes, especially those who are not from the Android generation, when you start bringing in change into their institution that will require them to go learn some new things, it becomes a problem. So no matter how productive, how efficient, how much everybody applauds the change, people are resistant to change, either because they don't have the knowledge, or they don't have the finances to acquire that if it's a private institution. Legal and regulatory barriers. This is also important, and it varies from country to country. So in some countries, there are laws that hinder the implementation of some brand of technology in health care. And these are issues that health professionals and government regulatory bodies will have to pay attention to. Data quality issues. So data quality is also an issue. And data quality is, to me, more of a confounder. First, if there's a challenge in accepting new technologies, there will be a challenge in improving data collection. Data quality it's much more about the data collection and storage, because the way you collect the data and store it determines what quality of data it is. If your data is accurately collected and stored in a fashion that people cannot change it without permission, the quality begins to improve. If your data, if you are using a secondary data, which means that this data has already been processed by a first party, the quality of your data will depend a lot on how the previous party processed that data. The interpretation a medical doctor will give on a patient's laboratory report will depend on how the laboratory physician key in that data or collected that data. Ethical considerations. So this is another very important area. Ethics is the backbone of health. Ethics is the backbone of every community. We need to respect some ethical considerations in order to be able to do this. When we have to set down norms on how to collect personal data, how to store and protect personal data, how to share information. Does the government has a right to just step into the institution and pick up any data because it's available? What procedures need to be followed to share this data and stuff like that? If you followed during COVID, there was some consideration of a digital passport where your vaccination status will be keyed in. This raised a lot of ethical issues, and that technology was not implemented. This is just an example of some of the barriers that we have as going ahead. Because if this information was integrated into a digital passport, the probability that those who do not need to know will begin to know, get information that they don't deserve, will be high. So these are some of the things that also hinder the implementation of hard informatics in institutions or countries. Discussion. So based on all of this, we want to look at what we came up with for each of the questions that we had at the beginning. How does medical informatics impact disease surveillance and outbreak management in public health systems or setups? So this study showed that medical informatics improves monitoring and prevention of outbreaks in public health. We could see how fast COVID was handled, even though it was a heavy pandemic. We could see how fast a vaccine could come out of COVID, even though we know how long it takes to produce a standard vaccine. This study also showed that health informatic tools have replaced conventional surveillance systems, enhancing the monitoring of disease and detection of epidemics. This is obvious in many different countries. I'm not sure what is the scope of this in developing countries, but in advanced countries, this has played a very positive role. Thus, the finding emphasized the importance of medical informatics in disease surveillance and outbreak controls in public health systems. For the next question, what are the effects of medical informatics on patient outcomes and healthcare delivery? The research established that medical informatics has a significant impact on patients' outcome and the efficiency of healthcare system. This research also established that clinical decision support system has a critical role in decision-making process in healthcare deliveries, as we discussed earlier. The study also confirmed that informatic tools are useful in reducing the rate of medication errors and adverse events, just as we discussed in the case of a lab technician collecting a patient's data, and any slight made them will affect the conclusion from the medical doctor, and that will impact the patient's health. Therefore, these studies support the need and relevance of medical informatics in enhancing patient care and overall health service deliveries. And the last question we had was, what challenges and barriers exist in implementation of medical informatics in public health systems and setups? Data privacy, as the graph showed. Other challenges related to interoperability were also noted. The adoption of new technology requires careful integration into existing systems. This leads to resistance to change, which also affect effectiveness of medical information. And so these findings reveal the complexity of medical informatics in public health systems. Recommendations. Based on these studies, our findings, we recommended that there should be enhanced integration and compatibility between diverse health information systems. This is very crucial because in most settings, state institutions and private institutions have a huge gap in technological framework. So the states can buy heavy equipment, high technology, and then the private institutions are just struggling to catch up with this. The problem now becomes when you have to move a patient from one setup to another. How do you intend to manage that transition? Increase financial support. So we're recommending that financial consideration be given in the acquisition of advanced technology for the betterment of the patient's health. And this implies states should be able to give subventions to universities, to health institutions, to enable them acquire latest technology that is approved by the health board. Enhance technical infrastructure, just what we discussed. Foster change management. There should be a process in place to enhance change management, to enable the old staff learn the new tricks and to be able to convert the old technologies to new ones. This will facilitate this will reduce resistance to change. Address legal and regulatory issues. This is a very challenging one, but we keep mentioning it. This has to deal with the states. The states has a very different mechanics in how they operate, but it's important that we do the education, provides to them the scientific background or knowledge that they need to be able to make these laws that will facilitate the implementation of appropriate technology. Ensure data quality. So as we mentioned earlier, data quality, for it to be efficient, it has to be consistent. So the quality of data from collection point to storage to processing, to interpretation has to be up to date. So I don't use a poor quality data and I expect to have a good quality result. Whatever interpretation you give to that, garbage in, garbage out. Promote collaborative efforts. This is a very important aspect as well. This is getting towards advising or trying to have states standardize institutional operations. So there should be some softwares for particular health issues that for your health institution to run, you should have that. So if you live in a country where, let's say, malaria is a common occurrence, then before your health institution should be approved, it should show proof that it can interpret results from any laboratory, so that there should be a standard software approved for all institutions in those kind of places. This will try to improve on collaboration, because if a patient moves from one hospital to another and the interpretation is the same, then it's good for the patient. But if a patient... Can you hear me? Somebody say my mic.
Yes.
Oh.
Yeah,
Yes.
I'm hearing you.
Yes.
Okay. Thank you.
Yeah, we can hear you very well.
Okay, thank you. Then we also have to invest in research and development, just like what Kesmon University is doing. So we have to send this information out. We have to flag the importance of certain areas of development and let our government and institutions invest in research in those areas. In conclusion, the study found that technologies such as electronic health records and analytic models have revolutionized medical informatics. These technologies have enhanced disease tracking and quality of care. However, barriers such as technological integration have negatively influenced the adoption of medical informatics in healthcare settings. Further, the findings stress to the importance of strong protection of patient data, enhancement of cross-system information exchange, specification, adequate financial support, and sound change implementation plan. These findings are instrumental for policymakers in the medical domain. These are some of the references that we use. Given that it's an article, there's quite a litany of references, and you can get them from the paper. Thank you very much for your kind attention. Over to you, Prof.
All right. Thank you very much, Max. It's been an amazing presentation. It's been recorded so that we can share with the general public to understand the role of medical informatics in public health transformation, especially in Africa, where using information technology in the medical sector is still very myopic. So in this study that we were focused on evaluating the role of medical informatics in public health practices, especially in disease surveillance, patient management, and in the management of the healthcare systems, it is very imperative that healthcare providers, especially in developing and less developed countries, need to understand and adopt the changes in technology, especially innovation has come with artificial intelligence being used in the healthcare systems, telemedicine, and a lot of other technological advancements have come into the healthcare system. And we're excited that medical informatics contribute to patient safety and quality of care. We're excited that innovation in healthcare systems is very important. So this study was conducted in order to sensitize and also to inform healthcare providers, ministries of education, directorates of health, to understand the role of medical informatics in the advancement of healthcare systems, especially in Africa, where these systems have not yet been adopted. So, should you have any question, please, we are very, very delighted to listen to you and to give you our understanding. You should understand Marcelo is a statistician, so he specializes in healthcare services, and he is a doctoral fellow, and we are excited to have him within our systems because he is a graduate from Ghent after completing biostatistics in Belgium, now living in the United States, where they have the most advanced healthcare systems, and conducting a research in order to advance the healthcare systems in our continent of Africa. So we are excited that he is using his expertise to promote healthcare systems within this continent. And I'm happy that in this presentation we have directors of healthcare systems, directors of hospitals are present, and they have followed keenly. And I know we also have university directors. I am excited to welcome Prof. Rudolph, who is our partner, and he runs a medical institution as well, and he would follow and understand the importance of introducing these systems within their own organization. So should you have any question, please, we're excited to listen to you, especially Prof. Rudolph Kwame, University Partners. Thank you.
Thank you very much, Professor. I'm speaking from Liberia, West Africa. I'm the founder of Rudolph Kwame University, and I want to appreciate the presenter in demonstrated well to mine observations. I want to know from him what are some of the causes that health practitioners, they don't really give the exact figures of things that have been like a pandemic, in case of coronavirus, in case of Ebola, and so forth. What are some of the reasons they don't want to get exact things, exact information? So I want to know.
Thank you very much, Professor Kwame. Kwano? Sorry, I got it wrong. Okay, this is a very serious issue. This falls under ethical considerations. But it's a bit transcends that to politics. The first thing that we had this discussion with one of our state governors, precisely, I think that was the governor of New York. During the COVID, in his states, the accurate results of the prevalence was not given, of the things were not given. And the reason was just that people want to show that they're in control. People want to paint a particular image. So he was trying to, oh, I handled the pandemic very well, people do not die and stuff like that. So he's preparing his kind of a political trajectory. In other cases, it's mismanagement. So there's money deployed to manage this, and then people don't manage it well, but they have to be accountable. So they have to convince where something was done. In other cases, it's just poor data collection. Poor data collection. They do not they don't have the means, or the means is there, but the workers are sloppy.
All right. Thank you very much.
You're welcome.
Thank you, Prof. Kwame. Are there any other questions, Dr. Damilero, Dr. Jaram? Dr. Pauline, are you there?
Yes, I am.
Hello, good afternoon, members.
Good afternoon, Dr.
Good
Damilero.
afternoon.
Yeah, this is Jamudiro Samuel. I'm a PhD student, Environment and Climate Change, Kesmon International University. I have been following the presenter from the very beginning to the end, and I would like to make one critical observation. The very first one is appreciation. I have been so keen following him, but what is so critical with my observation is that he was so alive in connecting his discussion, his findings, his conclusion, his recommendations based on the research questions. I find that so special to him, and I'm here to appreciate him. Now, on that very note, I request the KI administration to, I've heard that they have recorded the system. It will be good enough they share that recording, especially to some of us who are next. I thank you so much.
Thank you.
Thank you.
Okay. Thank you, Mr. Jamuliro. Mr. Atanda, I'd like to ask you a question. Are you there?
I'm there. Thank you.
Okay. How do you think we can improve healthcare systems in Africa? I am interested in this case, in the case of Kenya, my home country.
Okay. We can. The first answer is we can. The second is how can we? The first, we are taking the good step. Do we know the right things? In most cases, people don't know the right things. We first of all need to seek the right things through education. I'm happy you're here. I'm happy Kesmon University is there, educating a number of people. They said education is a prelude to wise decision. So when we educated in the right framework or in the right setting, then we are bound to start making the right decisions. But something will come in, especially I'm very keen. I always relate this to politics. We have to be consistent with what is right and what we implement. So if you follow the presentation, the challenge that we're going to have is that in most African countries, we are not investing in technology. What does this mean? It means that the cost of implementing technology from the resource, the infrastructure, and the technical know-how becomes very high. So if you need to, let me take an example. How many countries in Africa has a centralized database for their citizens? This is already a first problem. Not to talk of how many countries in Africa have a central system that has all the health institutions linked together, so that changes in one end can be seen by verified professionals on the other end. Those in the know, if they key into their system that, hey, we have an epidemic of cholera, how long will it take the person in the East to know that there is cholera in the North? So these are, we missed a lot of steps. So let's, the medical or the whole, those of us in the academic field, propagate the ways of development. And this era is a technological development. So let's start the technology. Have central systems for our institutions and our country. Advocate for advanced technology. I took a research sometimes in Cameroon when I was doing a research in public health. It may surprise you that there are countries in Africa that they don't even have a mammography. I mean, in the whole country. So please, this is embarrassing. This is an issue of lack of knowledge, because I want to say that Africa is not poor. It is the mindset. Can we agree, convince our leaders, make our peers understand that technology is at the center of all of this development? I may interest you, as Prof said earlier, I am from the medical background, but since I moved to US, I got my master's in information technology engineering. So I'm trying to put these two together. But in the midst of all of it, for Kenya to start changing, they should start imposing information technology in all systems, especially the health system.
Okay, thank you very much. Your topic is one very exciting subject, and thank you so much for your explanation. Another question is, could you help me understand the difference between data analytics and health informatics and their applications in the public health?
Thank you. How do I approach this as a good one? So I will go back to what I said earlier. Health informatics, I mean, it's interchangeable, called medical informatics. So this actually refers to the collection, the storage, the processing. I'm being a bit careful about this word processing. This processing can either be analytic or just simply be management. Let me use a generalized term, management, with the intent to offer certain services. For prediction, for surveillance, for decision making and stuff. That is health informatics. The collection and storage of any information that will impact health. But most importantly, patient's information. Now let's come back to analysis, data analytics. I happen to have a very huge background in database management and cloud activity. In analytics, it means processing data in a particular trend. We may have data. Okay, for instance, we are in this presentation. I'm not sure how many of us are there, approximately 14 of us or 15. That's information. How many professors and how many students? That information, what is the gender parity? That's information. From which country are they coming from? That's information. No, be careful. That's not information. That's data. This data can be transformed into information. That information can be used for public health. So we have data, which is just simply the collection. This is a bit collection of objects, collection of stuff. And we process this data to have information. And we need to use this information to either make decisions or to have an understanding of something. So an analytic simply helps you to process data so that you can get information. And then in healthcare, we are processing patients' data to get information to support that patient. But patient data now is a bit generic. Sometimes that data is not only about the patient. So my data is not just about my weight, my height, my blood pressure. It's also about where I live, what I eat, and stuff like that. That is, I have to process all of this to have a proper information about me. So thank you.
Okay, thank you very much. And thank you for your explanation. I think I'll give it to Professor Atanga to finalize, or in case any other person has a question, so that you can proceed. Prof. Atanga?
Yes, ma'am. Yes. Thank you very much. Thank you. You know, people always question the difference between data analytics and informatics. And with the advancement in science, the involvement in technology, data analysis, using quantitative or qualitative techniques has a trend which has to be followed. But when we come to informatics, we are focused on collaborative activities that involves people, processes, technology. And when we look at data analytics, we are looking at statistics. We are looking at database management. We are looking at query of language. We're looking at the use of softwares, computer programs, and all the like. But when you go back to informatics, you need to look at the systems involved. You need to know what kind of system, know the information, the standards involved. You should be able to manage information tools in the application, in the programs you're using. You should also be able to have good communication skills. As you followed with Max Atanga, you would see in this domain, I would always recommend people to follow up and understand that when you do data analytics, information technology, information management, you must be able to have good communication skills that helps in designing and developing to secure a user-centered knowledge structures for the systems you're involved in. So it's been a wonderful presentation, and we are still open for questions. Should in case anyone has any contribution, we will welcome your contributions. Thank you. Chabo Nelson, are you with us?
If somebody has a hand up, Emmanuel?
Yes, Prof. Yes, Prof, I'm with you.
All right. Lumure.
Yes, thanks so much. This is Lumure Emmanuel, student at Kesmon International University, Uganda. I'm actually a student who is pursuing my master's in maternal, newborn, and child health. So mine is not a question, but I really want to appreciate Professor Atanga for his detailed presentation. What I want to say, like in our country here, actually, you find that there was issues about the issues related to health informatics, whereby sometimes we have the data which is not captured in the system, and then you find that this really sometimes it affects the healthcare system. So with all the recommendation that you gave forward, I'm quite sure that as we are going into detail, like having digitalize the system in place. Having a digitalized system in place, I think, is good, because if we store an information in a digital way, we are able to ensure that at least this information is being kept safe. And with this, I'm quite sure we shall not have any missing data or anything that will be missing out. So we'll appreciate you so much for this presentation. And this is actually the good way to go. And thanks so much, National University, for bringing it. What my appeal is, please, if you don't mind, share this on the group, the presentation, so that we also keep on learning, and then to enhance our learning at Kesmon International University. So thanks so much, and over to you.
Thank you, Lumore. Thank you. Thank you very much. Are there any more contributions, any comments? All right. In the absence of any more contributions, comments, Dr. Pauline, please kindly conclude so that we can end the session. And we want to really thank the presenter. We are looking forward to your next presentation that might be coming up in a fortnight. We're going to share the details with everyone, and the IT team, please follow up and make sure that this presentation, the recordings are shared, because this is a session that was important for learning basis. Thank you. Dr. Pauline, over to you.
Thank you very much. Okay, thank you to each one of you who attended this session. It's been very educative, and I'm sure each one of us enjoyed it. As we conclude, thank you so much, Mr. Atanga. Your presentation was very, very good and very, very interesting. Keep up. I'm wishing you all a very good afternoon, and we'll see each other the next time. We'll post the next presentation. Thank you, and have a lovely day.
Thank you very much.
Thank you so much.
Thank you.